Sorry. Hello, good afternoon, good morning, and good evening. Thank you for joining today's live Q&A with Dr. Mike Ryan and Dr. Maria Van Kerkhove, as usual, on COVID-19 update. We will also touch upon COVID-19 update and response in other emergencies, such as the most recent one in Ukraine. So please send us your questions if you're watching on Twitter using the hashtag AskWHO. If you're watching us on other platforms, please use the comment section, and I will pass your questions to Mike and Maria as usual. Good afternoon, Maria. Mike, thank you for your time. These recent weeks have been even more busy, so we had to change this regular schedule of Tuesday, but next week we'll be back on Tuesday. We're seeing, Maria, a lot of false sense that COVID is over. So can you maybe start with the epidemiological update and where is COVID spreading at the moment, and are mortality data as high as they used to be a couple of weeks ago when we spoke last time?
So thanks, Alex, for having us. Indeed, it's quite a busy time for everyone. So we are still tracking this virus quite closely around the world, and we are still seeing a large number of cases being reported to WHO. In the last week, we've had more than 10 million cases reported to us, and more than 52,000 deaths reported. Now, those are lower than they were the week before, and we are seeing a declining trend at a global level, but that declining trend is not the same in all regions of the world. And in fact, in the Western Pacific region, across Asia and the Western Pacific and the islands, we've seen quite an increase in cases in the last week, almost a 50% increase in the last week alone. And so with 10 million cases still being reported, that's quite an intense level of spread. With more than 50,000 people dying every week or reported to be dying, we know that's an underestimate. And we are concerned that with a decrease in the amount of testing that's happening worldwide, that we may not be tracking this virus as closely as we can. And so we're very much still dealing with COVID-19. I know we want this all to be over. We do as well. But we recognize, entering this third year and being in the third year of this pandemic, that there are so many challenges that we face beyond COVID-19. But we still have to maintain our vigilance for this virus because there's so much that we can do to save people's lives now. And a lot of that is around vaccination, but it's not just vaccination. It's around making sure that we have good surveillance, we have good testing, that people get into that clinical care pathway. Because with a virus circulating at such an intense level, we are worried about the continued virus evolution, and this virus is evolving still. So the more it circulates, the more opportunities it has to change, and there is the continued risk of further variants of concern. We have Omicron that is circulating worldwide. It's dominant. Almost 100% of the sequences that have been shared across the world are Omicron. The different sublineages, BA.1 and BA.2, but the virus is still evolving. And so there could be, and there are likely to be more variants. And so what we are trying to ensure that at a global level, at national level, at subnational levels, that we still keep a close eye on the virus itself, so that we can pick up those variants as quickly as possible and make any necessary adjustments as needed. So we need to maintain that vigilance on COVID, and that doesn't mean that we lock everybody in or we lock anyone away, because we have tools now that can actually reduce the spread, but we can also save lives right now.
Thank you so much, Maria. Mike, what is your view on the current situation and also this impression that COVID is over?
Yeah, I think, again, we've said it many times, there are countries increasingly, thankfully, in the world that have reached very high vaccination levels. Their health systems have recovered and people are getting back to normal life. And we want to see that kind of normalization. But what we don't want to see is a situation where we minimize the uncertainty we're facing, or we minimize the potential scenarios in which things can go wrong. We don't want people sitting up day and night worried about what's going to happen with SARS-CoV-2 or COVID. People are done with that in that sense. But what we need to do is governments, the health system, the surveillance systems need to maintain vigilance. We need to keep track of the virus, as Maria said. We can't stop testing. We need to know how this virus is evolving. We have to keep pushing. When we look at countries now with low vaccination rates, and particularly those with low vaccination rates in older persons and persons with underlying conditions, and we've seen this in the Western Pacific, we've seen a different pattern of countries emerging from the pandemic phase in the East Asia and the Western Pacific. We see many countries who had very low incidence over the whole period of the pandemic, and they had very good control over the virus. Some have managed to get vaccination levels very high in the meantime, and they're coming out of the pandemic phase without too much damage. Others have found it difficult, and they've struggled to vaccinate, particularly older persons, and I've been quite surprised with this, that there've been a high level of vaccine availability, but a low uptake amongst older persons, persons with underlying conditions. And when you now look at some of these situations in East Asia, the pandemic, the deaths and the hospitalizations are effectively been driven by unvaccinated or under-vaccinated people in the older age group with underlying conditions. So when we talk about the 70% target for the world, that's an overall target. What we absolutely have to make sure is that all vulnerable people, all people with underlying conditions, people with immunosuppression, people who will develop severe disease are vaccinated, because in a sense we want to move from this pandemic response that's relied on very strong public health and social measures that have disrupted people's life to sustained control of the pandemic and its impact. The only pathway to get there is high levels of vaccination, sustained surveillance, as Maria said, good clinical management. So we can look on this disease as another disease. As we look at influenza, a disease we can prevent by vaccination, a disease we can treat in hospital, and a disease that will not disrupt society next year or the year after or for countless years to come. So I think that's in reach, and I think I've heard you say this before. This is within our control. This is a choice. It's not a destiny. It's a choice we make today, what we want to be experiencing in 6 months or in a year's time. And I believe we're getting closer and closer in many countries. So we're not without hope, but I do share Maria's concern that the longer we leave the virus in this phase of intense transmission, the more chance we have of having the emergence of a new variant. And even if a new variant emerges, we can still manage that. But there are scenarios, and these scenarios are very low chance of them happening. But there are scenarios in which we reset. There are scenarios in which we go back to zero. And we need to prevent that happening, and we can. We can do an awful lot to stop that scenario. I don't think, in terms of the emergence of variants, I think we will see continued evolution, and we may see new variants emerge. But I believe it's clear now that our vaccines are working well, that we have the means to contain and control the impact of those variants with our current measures if they're applied properly. But we also need to be aware that there are circumstances in which we could get a real setback, and we need to be ready to deal with that.
May I add something? Because I just want to come back to this, your question of this false sense that it's over. I mean, nobody wants to hear us say that the pandemic isn't over yet. We recognize that, and we don't want to say it either. We recognize where people are in this time and the challenges that everybody faces. But I think as we talk about the tools that we have to actually take out the death, the hospitalizations and the deaths, we're seeing right now far too high levels of hospitalization, far too high levels of death, and that is not a manageable state. And that's what we're talking about. We need to get to this point where we end this emergency of COVID-19, and we're not quite there yet. So what we're asking for and what we're working with governments is how do we adjust the strategy and balance the needs of dealing with COVID-19 so that we save people's lives, but also ensure that people get the care that they need for other diseases, that you deal with the other challenges that are being faced in countries, in families, and at an individual level. So we recognize that, and our job is to ensure that we provide this support through our regional offices, through our country offices, to all countries, to all people, so that you have the right tools and the right policies that are in place that get that balance right. It's not the time to stop, but it's also not the time to go from this pendulum swing to everything in place or nothing in place. There has been significant achievements and significant advancements and enhancements of surveillance, of testing capacities globally, of genomic sequencing. We don't want to see that dismantled. We don't want to see that reduced. What we want to see is that reinforced and strengthened for COVID, but also for other threats that we face. Now is the time to really support those actions and use that as a platform going forward. No going back. We're not going back. We're going forward, but we want to use this as a positive to make sure that at a global level, at national levels, at subnational levels, we're better prepared for this, for the immediate challenges that we face, but all of the challenges that we face going forward.
Thank you so much to both of you. There are some questions on, as you both addressed, that this virus is still evolving. And one of the Facebook viewers is asking, is it true that the variants now that will come be more or less severe? Sorry, is it true that variants now that will be or are more or less severe? Sorry, there are some typos there, so I am...
It's a fantastic question because we get this question every day. There are some people that are speaking with quite some certainty that the next variant will be X, the next variant will be Y, the next variant will have these characteristics. But unfortunately, there's still some uncertainty around that. What we are planning for, as we learn, as we watch in real time how this virus is evolving, we're looking at the changes in the genetic code, in the virus itself, and we're planning for different types of scenarios. A variant that will be more transmissible, more fit. You've heard us talk about that before, and it's likely that the next variant of concern will be more fit because it will have to overtake whatever is circulating. Future variants may have characteristics of further immune escape, which may mean that our vaccines are not as effective as they are right now. And I want to highlight that the COVID-19 vaccines are incredibly effective against severe disease, even against Omicron and the sublineages that we are tracking. But in terms of severity, the next variant of concern may be more severe or it may be less severe. We don't know, but we need to plan for that. Having said that, there's a lot of population-level immunity across the world, either from vaccination or from past infection. And that means that our bodies have this memory and an immune response. So even if the next variant emerges that may be more severe or less severe, we are not starting from scratch in that sense. So I think we're looking at the different possibilities of variants. We're also looking at the possibility of recombinants, which are combinations of viruses. And you heard a few weeks ago myself with my colleagues Lorenzo and Anurag, the head of the Technical Advisory Group for Virus Evolution, talk about this possibility. It's something we just have to be prepared for, which is why surveillance needs to be strengthened. One of the main reasons why we need good surveillance, beyond tracking trends, beyond understanding disease patterns and in particular groups, is really to track these variants so that we have good eyes and ears around the world. And sequencing remains absolutely critical to that. And testing remains absolutely critical to that. But it's not just necessarily more. It's good geographic coverage, it's strategic testing, it's strategic sequencing. And many countries are doing that. And as I said, we want to make sure that that's strengthened and that's not reduced right now.
Thank you so much, Maria. Mike, maybe you can take this question from Katrin watching us on LinkedIn. When will be the right time, she says, for mandates, but I believe she thinks for public health and social measures to be fully lifted?
I think that pretty much depends on what the situation is in any given country. I mean, if you're in a number of countries right now in Southeast Asia, Western Pacific, then there's a need to continue many of the mandates. And again, it depends what type of mandate we're talking about. I mean, even without mandates, there probably is a lot of good reason for people to continue to wear masks in crowded spaces, on public transport, to continue to be careful around things like that, to ensure that they're vaccinated, and to be careful around large crowds, particularly inside. So that's probably just becoming, I think, more and more a kind of a fairly standard practice for people while we experience the pandemic anywhere. But there are specific situations and countries in which there is a need to continue suppressing transmission of the virus because the health system is still under a great deal of pressure and vaccination levels aren't that high. So again, it's a difficult question to answer in a specific environment. With regards to mandates, again, nobody wants to impose mandates on people, but where governments support certain action by the community and make these actions, at least make it clear that these actions should be taken, that can allow people to take that action and know that that is what the government have decided, the scientists have advised. And when governments lift those restrictions, as we've called them, that doesn't, and that's fine. But the difficulty is sometimes that responsibility then is passed on to individuals. And then it's difficult because people then think, well, okay, the government say we don't have to do this anymore, but I feel uncomfortable. I'd like to still wear my mask in the shop. Am I allowed to wear my mask in the shop? I've had people ask me that. And I've said, well, that's your individual choice. So, for example, I've seen situations where people visiting a shop, the people who are welcoming them notice the person has a mask, and they say to the person, well, would you prefer if I wear a mask? Would that make you feel more comfortable? That's the kind of consideration, that's the kind of behaviour we need, where there are individuals in our society who will continue to remain vulnerable and exposed if they get infected, even if they're vaccinated. So if people in society choose to continue with certain measures, they shouldn't be criticised for that. And at the same time, if the situation is such that people are allowed to go back and eat in restaurants and go and have fun, then we're not we don't want to suck the fun out of life for people. So that's not what this is about. So people should go listen to their government, go back and do the things that they're being allowed to do again. But just be careful, just think, be smart. Even with those restrictions lifted, there are still situations where you'd say to yourself, you know what, maybe I should wear a mask. And that's all the more important for people who have underlying conditions or have a person at home with an underlying condition or in a frail state. So it's going to come down to that. As regards to the general question of when does the pandemic end, in a sense the virus itself will continue to evolve. The virus will never end and the microbes are never ending. We've only in the history of humankind ever managed to eradicate one virus, and that's the smallpox virus. We have struggled for years to do the same with polio, and that's the second one on the cards. And it's taken a 20, 30-year program and billions and billions and billions of dollars and a massive global effort to get down to a point where we only have a few countries left with the wild virus. So it just shows how difficult it is to get rid of a virus. But what we have shown with vaccination, with public health over the years, and we've all experienced that ourselves as children, we've experienced the benefits of a public health approach with a good surveillance system, with early childhood vaccination, with early access to treatment. The diseases that used to take kids away, and those of you out there who are old enough to remember the generations, and we see the same right now, tragically, in emergencies and in fragile states and in low-income countries now, how many children were taken away early in their lives because of these infectious diseases and others. And what stopped that happening? What stopped that happening was education, economic growth, access to services, basic vaccination, basic access to healthcare, access to primary healthcare. That's what stops these infectious diseases, and it will be the same with COVID as we go forward. That it's really helping the core health service to recover so that it continues to provide those services, and then integrating COVID care into the normal system, into the normal health system, in a way in which we can sustain this. If we get to that, then I consider the pandemic phase, I consider the emergency associated with the pandemic to be over. The same way after a storm, you don't wait until there's zero wind to say the storm is over. We have different levels, and we say, well, actually the worst of the storm is past and people can go back on the street and go about their business. It's still very windy, it's still wind, but the phase in which it was dangerous to move around has passed. And I think that's the issue for us, is has the phase where we need to sustain efforts to stop this virus and treat people and vaccinate passed? It hasn't yet. And we're not through the phase where we can step back and say, this is now okay to just regard this as any other virus. Any other virus isn't killing 52,000 people around the world at a low estimate and 10 million cases every week. That's not just any other virus. And knowing the uncertainty we know around the evolution of that virus, we need to remain vigilant. But as I said, at the same time, those who are lucky enough, who are vaccinated, who live in a country where you have high levels of vaccination and the health system has recovered, then congratulations, it's fantastic. People can go back to enjoying something like a normal life. But not everyone is there yet. And until we get to that vaccination target, not everyone will be.
Thank you, Mike. And you mentioned the emergency as COVID-19 itself is, and it's still public health emergency of international concern, so which we actually declared 30th of January 2020, a long time ago. 6 weeks later, 11th of March, we described this outbreak as a pandemic, and tomorrow is 2 years since that moment. So some of our viewers are bringing again the question of endemic. So based on what you were just describing, are we getting into that time where we're going to describe COVID-19 endemic?
Yeah, I think we need to be careful with words here in terms of the word endemic, because yes, endemic means in a sense that the virus is present and transmitting at lower levels, usually with some form of seasonal transmission or increases that are seasonal or outbreaks on top of an endemic situation. That's very classic for many infectious diseases. But remember, endemic HIV and endemic tuberculosis and endemic malaria kill millions of people on this planet every year. So please don't equate endemic with equals good. Endemic diseases require strong control programs to reduce the infections, reduce the suffering, and reduce the death. So just changing from pandemic to endemic is just changing the label. That doesn't change the challenge we face. We need sustained control on this virus. We need sustained protection of our most vulnerable. We need strong health systems to deal with those infections we can't prevent. And we need to be able to continue to do that with the levels of infection we experience. If we reach that, then yes, we have an endemic situation over which we have control. And it's manageable. So I prefer, rather than use endemic, I'd nearly prefer to use, we have a manageable situation. We're in control. And when we talk about the word pandemic and WHO's declaration of a public health emergency, a global health emergency in January, I often liken it to a global flood. We all know the myths and legends and the stories of the global flood, and the issue would be in that situation, it was almost in the 30th of January, we were telling the world is flooding, there's going to be a global flood, you need to do something. And the world was possessed with the word pandemic. And the word pandemic means pandemos, pan, every, demos, body, right? So pandemos means everywhere, everybody. By the time we got to mid-March, I think the situation was such that there was such a, what I was most stunned by was the lack of response, was the lack of urgency in relation to WHO's highest level of alert. In international law, as agreed by all our member states. They agreed to this. They agreed to this term. They agreed that this term would trigger all kinds of actions. And yes, in some places it did, and in some places it didn't. But by the time we got to March, we were basically, if you're again declaring the global flood, do I wait until every piece of dry land is flooded and then I say, we have a global flood? Because that's what we were doing on March. We were saying, global flood confirmed. This planet is now flooded with virus. What we were saying in January was, it's coming, it's real, get ready, right? Now, which warning is more important? Which warning would you prefer if you were on an island? Do you want the warning to say you've just drowned, or would you like the warning to say the flood is coming? Get yourself organized, right? And this is why I sometimes get frustrated around how important the warning in January was way more important than the announcement in March. And there's a lot of people in the media now who have this big argument. WHO declared declared a pandemic late. No, we warned the world. The world was well warned about the impending pandemic that was on its way, and we spoke about that, and the DG was very careful. He said we have not reached a pandemic yet, but it could well become one, right? You know, we knew that. We were trying to get people to act, without panicking, trying to get people to act without stumbling, trying to get governments to take action without generating a sense of panic amongst ordinary people. By March, I think there was such frustration that it was okay. You want a pandemic? Here's your pandemic. But you know but declaring a pandemic, as I said, the more important announcement was in January. But some people have characterised the announcement in March as something unique or special. For me, that was just declaring the obvious. We were declaring the unobvious at the end of January because we had less than 100 cases outside China. So we were declaring something not obvious, and people weren't listening. We were ringing the bell, and people weren't acting. And everyone's focused on the fact that it was in March that the real thing happened. No, that was our problem. That was our mistake. Our mistake was we listened to the wrong alarm. We waited until someone was ringing a bell on top of the last patch of dry land going, it's a pandemic. That doesn't help anyone. What should have helped was the announcement at the end of January. That's what should have triggered the global action. That's what should have triggered the global collaboration. And I think maybe a lesson learned maybe for the next time we have to go through this. Although I hope I'm well retired before that ever happens.
Can I comment on that
Please.
also, because I think this is so critical, and we're still making the same mistake. The fact that people are celebrating and not celebrating or recognizing the anniversary tomorrow is the wrong anniversary. We need your help. Like, we need the help of journalists and of media and of comedians. I even hear comedians, talking about this as an anniversary of when everything locked down. That is not the anniversary. The anniversary is when the warning was issued, as Mike just said. You issue the warning to prepare. You don't issue the warning when you're in the middle of it and everyone is drowning. And I think that we continue to need the help of others to emphasize this. Because the fact that there will be so many discussions tomorrow, perhaps, maybe not, maybe people have already moved on, that tomorrow is that anniversary, is incorrect. It is fundamentally incorrect. And we had been talking about the threat of a pandemic or becoming a pandemic and that alarm. And you hear the frustration in our voices because we still haven't corrected the narrative. The alarm is the public health emergency of international concern. This will happen again. It will happen again. So when are we actually going to learn? And we're still in it. I'm sorry, but we're still actually in it. The world is still flooded with this. While we want to move on, as do both of us, we are still in the middle of this flood. So we can't will it away. We have the tools. We have to use them strategically. More than 6 million people have died that we know of. I don't think we've even begun to grieve this at a global level or even think about this. Some countries have reached more than 1 million deaths. I can't even wrap my head around that. We've literally changed the ecosystem of our planet with this virus, and we need to deal with it. We also need to change with it. You were asking, the question was around mandates and the use of public health and social measures, the use of masks. I think we have fundamentally changed how we can deal with this because these are tools that exist. These are tools that people are actually have access to. There is no one size fits all here. We will not end this flood. We will not end this pandemic altogether at the same time. Countries are in very different situations, but make no doubt we're still in this flood. And if you remember when the Director General did say that on the 11th, he said that it was alarming levels of spread and alarming levels of inaction. What we don't want to be doing is right now live through inaction because we're tired of it. So much good work has been done on this. So many people have lost their lives. So many people have lost their livelihoods. Let's honor them by making sure that we invest and we enhance those systems now. There's just no excuse. So you hear the frustration, you'll continue to hear our frustration because we are all living this every day and we want this over as much as you do, but we can't will it away and we're still very much in this flood.
Thank you both. And actually, we're getting quite good questions and follow-up. And there is one coming from Rudwan Ahmed Ali watching us on Facebook asking, next pandemic, will the response be better?
We hope so. But it's more than hope. We're trying to lay the foundation for making it better. And this is the time. This is the time that the systems that we have in place are enhanced and strengthened so that we are better prepared. There's no going back. There should be no going back to, what we had before. We have ultimately changed the way that we deal with this. We need to use this horrible situation that we're going through to build that system so that the next time we start from a higher place. We start from a better place. As an organization, we're thinking about how do we move from this acute phase of this pandemic to something more longer term to ensure that we have the systems that we, as of the World Health Organization, are fit for purpose for the next one. Because we have to be thinking of that next one. You don't out there necessarily have to be thinking about that, but you should be comfortable knowing that there are people like us, and there are thousands, hundreds of thousands of scientists and public health, millions public health professionals around the world that are working so that we're in a better place for the next time. So hope is not the option here. We need to put in that work, and I think that we can. We can be in that better place for the next time. Unfortunately, there will be a next time. Hopefully not very soon, but we just have to be ready for that.
And it also depends, and I come back to Ali, and salam alaikum, Ali. The issue is how much we're prepared to invest collectively as a society in defending ourselves and being able to be protected from these organisms. We literally spend thousands of billions of dollars everywhere designing and delivering better means to kill each other. And we're seeing that deployed to horrific effect in Ukraine today. We design and we innovate on ways to break bones and break bodies and blow heads off and do all of that, right? And we vote for that. That's what you do as citizens. Or maybe your governments give you something you don't want, but that's what we do. That's the priority we set. Maybe we don't set that priority. Maybe we need to change our priorities. Maybe we need to tell our governments, maybe we need to tell the world, maybe we need to tell the United Nations system that that's not what we want. What we want is equity and social justice and climate justice, and what we want is fair access to healthcare, and what we want is health protection and health promotion, and in a safe environment free of chemicals and free of climate change that can allow us to thrive. And a system in which we can develop vaccines quickly and share them equitably in a crisis, and that we have a planet that isn't so completely out of balance, that we have a global system that isn't so completely fragmented, that we've industrialized violence, we've industrialized carnage, and monetized it to a point now where we have to look at the images we look at TV and every day, and our level of outrage at that is the appropriate level of outrage. I wish we had the same level of outrage for what has happened in places like Syria and in Yemen and in Tigray and in so many other places around the world. We watch that. So I do think it's about how we set priorities for ourselves, for our communities, for our governments, and for the international system. Are we actually investing in the right things? And frankly, right now, if you ask me as a public health doctor, no, we're not. And we can do so much better. We've proven it, and I think we've seen, much in all that we've talked about the uncertainties and the difficulties of this pandemic, we've also seen a triumph of science. We've seen a triumph of community resilience and community fortitude and people helping each other and communities supporting each other and non-governmental organizations and community groups, fighting like hell for their communities in the midst of COVID. People are powerful. Communities are powerful. Epidemics and pandemics begin and end in communities. That's where it happens. Yes, we design solutions that are far away from the community's needs. We don't focus on what communities need to survive and thrive. We focus on all those other external things. And in the end, communities are not served. So I think we have a lot of thinking to do. We have a lot of thinking to do as a global community, as citizens of the world, around what future we want. I certainly have thought about this more than at any other time in my life when I think about my kids and their kids and what future they're going to have. Because this generation, me included, we're screwing it up, and I hope to God the next generation will do better. But I still think I've seen enough of what is good about humanity, about our creativity, about our genuine desire to be one and work together and help each other. That I've seen enough of that to think, we could change this. But we have to recognize that things like social equity or inequity, climate inequity, health inequity, these are the drivers, and these are now intertwining. If you go to the countries of the Sahel in Africa, we've got a combination of drought, war, violence, infectious diseases. A lot of these risks are converging in many places. And we've seen this happen again and again and again. And we're allowing more and more people end up in these permanent wars. I mean, the average length of a humanitarian crisis is now 17 years. 17 years. It's not like a flood and 3 weeks later everyone is back. 17 years. We're leaving hundreds of millions of people to suffer forever in hell. And yes, then when the pandemic comes to us, or when something happens in Ukraine on the European continent, all of a sudden, wow, the world isn't fair, things are terrible, we need to do something. For billions of people, this has been the reality for generations. That's the fact. And we have a chance, maybe. I think there's enough outrage and there's enough energy, and if there's enough activism out there amongst young people in particular, to demand a change, and absolutely demand a change, and stand up, write to your representatives, engage, activate, come together, organize, do whatever it takes to change the future, because pandemic preparedness is like so many other things. It's just one piece of a puzzle we need to fix for the next generation. We've got to fix the climate puzzle, we're going to fix the pandemic puzzle, we've got to fix the equity and inclusion puzzle. We've just had International Women's Day, which was fantastic, and we've got to fix that if we're ever going to have a sustainable future. So all of those things. So it's not about, fix pandemics and the world is perfect. No, it's not. But we can go a hell of a long way to fixing it if we change the priorities. We tend to fix in life what we think is important. And very often in life we don't really change until we reach a point where we have to. We're human beings, right? And I think we've reached that point where we simply have to change. We have to change the way we live on the planet, we have to change the way we exploit the planet, we have to change the way we interact with each other, and we have to change the way we govern and the way we do business. And if we do that, maybe we'll have a slightly better place in a generation's time.
Thank you very much, Mike. This was very inspirational, and also thank you for bringing to the attention all different emergencies and conflicts where we are operating and supporting people, and also explaining how different emergencies are converging together. And speaking of, and as Ukraine is the most recent one, we are receiving quite a few questions from viewers on COVID-19 situation in Ukraine and among refugees, and what are we doing to support.
Maria may supplement, but rates of COVID-19 were actually dropping in Ukraine before the crisis began. They had peaked like many other countries in Europe. They had peaked in some sort of January, early February, and numbers were starting to come down. There was still quite a number of people in hospital needing oxygen. I think there were up to between 1,000 and 2,000, an average of around 1,500 people requiring sort of oxygen therapy in Ukraine at any one time. Vaccination rates were relatively low. I think of the order around 34% or so. So there was a vulnerability there, definitely. But that's not very different to some other countries in Eastern Europe. So, Ukraine was doing okay in the context of the sub-region that it's in. Ukraine has a competent health system. And certainly it's not, and I've heard this over the last few days, the COVID situation in Ukraine and people on the move. It's not that. I think what we have is a general situation in the surrounding countries, and that Eastern Europe in general, in that we've had sustained high levels of disease transmission in the context of fairly low vaccination levels, which means there's been a big impact of the Omicron wave, bigger than there might have been because the vaccination levels were low. So getting the whole sub-region vaccination levels up. This isn't about looking at people streaming across, and it's really important that people get this. 2 million people are running for their lives. They're not bringing disease and they're not bringing war. They're bringing themselves and their kids and their hope. That's what they're bringing. We can very easily deal with the health issues that they have by supporting them. There's no threat from people like that. And it's really important that our language and our narrative does not change on that. It doesn't. The one thing we have left as a society is our ability to care and our ability to reach out and support those who have nothing and those who are on the run. It's a fundamental principle of human life. So it's really important. Public health can easily deal with those threats, but there are increased risks to those people. People living in basements, people living in the cold, right now in Ukraine, people who haven't access to clean water, people under severe stress. They're very susceptible to being to outbreaks now and things like measles. Those people still left in Ukraine. War and pestilence have gone together. They've gone hand in hand since the beginning of man. The two things drive each other. They're intertwined. They cannot be separated. So this war is driving this. It's the war and it's the violence that's driving the public health risks. It's the war and the violence that's driving people to run. It's the war and the violence that's destroying the health system. That has to stop. We can help fix things. We can help put band-aids on. We can help shore up the system. But we can't fix things unless the violence stops, unless the war stops. So I think it's very, very important now that we see a shift there. But as regards, as I said, COVID could generally get worse in the region because a lot of people are stressed and on the move, low vaccination levels. We are working with the authorities in the surrounding countries to try and increase the vaccination levels of all citizens in the host community and in the refugee community. And we'll continue to work on that, on COVID, on measles, and all of the other vaccine-preventable diseases. We work with IOM, with UNHCR, with the national authorities, with the Red Cross on making sure that we focus on meeting the health needs of the people fleeing from Ukraine. But the difficulties right now and the real risks to health, in terms of imminent risk to health, are for those people still in Ukraine. They're very much at risk in terms of wounds, injuries, infectious diseases, and I can't imagine the mental stress and psychological stress they're under. And their mental health needs are very, very, very big right now.
Thank you so much, Mike. And Maria, please.
Just one quick thing to add, on top of what Mike has said about Ukraine and surrounding countries and refugees, there are many refugees around the world for other issues, and they deserve the same amount of care and compassion and attention that we are seeing for Ukraine. And that's not to minimize any one group over another, but there are a lot of people that have had to flee their homes over the course of decades, and they deserve vaccination, they deserve care. And as Mike has said, when people are disrupted from their homes and they move from their homes at such short notice, just think about your own life. If you had to move your family with whatever you had on your back, and some people are, very, very small children, women are having babies in the middle of this, but this is happening all over the world. And I think we need to recognize that, and I think we need to take another look at how we deal with refugees. And I second what Mike said about the refugees not carrying disease. That rhetoric has to stop, because every life on this planet matters. We need to treat every life with dignity, with care. It is not a luxury. It is a right. And it is something that everyone has a right to. So I think there's a lot of work in that area. We need to, for COVID specific, the virus will exploit situations like this. But again, there's a lot of effort that are happening amongst people in terms of vaccination coverage and trying to increase vaccination coverage of people, even within Ukraine. They still have surveillance systems that are functioning, but also across the borders into the neighboring countries to increase that coverage because we know these vaccines work. So there's a lot of attention that needs to be raised around this, particularly for Ukraine, and this war has to stop, but also for other refugees around the world. And I think they deserve just as much attention.
And just to add there, I forgot to add that we are working very hard on oxygen supplies within Ukraine, and that's important for COVID, but it's also important for pregnant women, for people undergoing surgery, for kids with pneumonia and other diseases. We are working very hard as well to get priority and have chief priority for Ukraine for some of the therapeutics that are life-saving, and Janet Diaz and her team and the team in United and others are working very hard to prioritise those supplies, because you can imagine antivirals in a situation where we may not be able to vaccinate so many people. Antivirals in that situation could become life-saving in people with underlying conditions. So who do you think should have the antivirals today? The countries that have big vaccination rates, or maybe in a situation like Ukraine, being able to use oral antivirals could be a really effective way of ensuring that we don't see unnecessary deaths. So we are trying to work with the drug companies who produce the drugs. We're working with our colleagues and partners in the Access to COVID Tools Accelerator, and then working with our clinical teams to try and the other UN agencies to see if we can maximise the support we give to the Ukrainian health system to reduce mortality from COVID-19. But there are so many other demands on that system right now. Just getting insulin into the country, getting simple anaesthetics into the country. Many of the hospitals were getting supplies too, but the problem is now they're cut off from electricity. So we have generators going in, but then you've got to connect generators to the system. You need engineers, and the generators need fuel, and then it goes on, right? And it becomes, without that sustained access, it's not just about sending in a convoy and a few boxes and then everything is fine. It's not. That's the simplest and smallest thing we can do. These hospitals and these health facilities need sustained support. They need water, clean water. They need power. They need oxygen. They need health workers who aren't working 24 hours a day for the last 2 weeks. They need to be relieved. We need to send in emergency medical teams to relieve them and let the existing health workers rest. It's a complex thing, and it's really hard to do complex public health and complex health interventions in the middle of a vicious conflict, in the middle of a war that's now breaking down into multiple fronts. So it's really tough to control any epidemic in war. Particularly hard in this situation, and there are many epidemic threats, as I said, including COVID. But we are focused on getting as much support as we can into the Ukrainian health system to at least help them deal with the worst impacts of this crisis.
Thank you so much, Mike. And also we have colleagues in neighboring countries supporting mothers and children and all the refugees coming in, and our colleagues on the ground spoke to some nurses who are welcoming them, and they were saying that also children are hungry, spend a lot of time in cold, so they are in a vulnerable situation at the moment. So one of our viewers is asking, do we have in particular some information about children who are leaving Ukraine and COVID-19 rates, given that they may be more vulnerable than usual?
They will be, but they're also probably more vulnerable at this point to bacterial pneumonia and other diseases, because that's when children chill and get very cold and are stressed. You can often have, it's not just COVID, it's about respiratory disease. So managing respiratory disease in children like this is really important, and it needs to be done early, and it needs to be done comprehensively, and I'm sure the systems in the surrounding countries are doing very well. And might I thank those governments and those citizens who've really done everything possible to support the arrival of refugees. And we will do everything with HCR, with our other UN partners, to support them. And we've sent surge teams, as you said, Alex, to the surrounding countries, and we will work with them. And we'll provide resources and technical assistance to help them help the refugees across the border. But one thing, and we'd have to be very clear on this, everyone coming to that border in Ukraine is a refugee. And it doesn't matter what passport they carry, it doesn't matter what their residency status is. They're fleeing war. And we need to make sure we treat each and every one of them with the same acceptance and the same kindness. We can sort out the residency status and other issues later, but we can't have any profiling of people according to their status, their ethnicity, their race, or anything else. They're fleeing war, and each and every person deserves exactly, and I mean exactly, the same treatment and care. And that is happening for the most part. But we need to avoid any question that there's differential treatment of people coming across the border. That would be deeply, and on top of a tragedy, another tragedy.
Thank you both for today. I think we are running out of time. I would also like to stress and try to end, and maybe on a note of hope, that we've seen very also nice moments of solidarity, of people in neighboring countries accepting refugees, providing care, providing them homes and place to stay and food to eat, together with our colleagues there. So we thank them as well. I thank you for your time today. I thank all our viewers for their questions. We'll keep updating on COVID-19, but also on other emergencies we are responding to, not only Ukraine. So stay with us, and as Mike suggested as well, there are things that we can do despite measures being lifted, and be mindful of each other, and that somebody may be a vulnerable person, that we should still wear a mask, keep the distance, open windows, etc., etc. So thank you and stay safe.